Good morning, everyone. In the previous element, we discussed physical and psychological health. We look at how hazards such as noise, chemicals, and workplace stress can affect workers over time. Now, we move to another very important and practical topic, which is musculoskeletal health. Musculoskeletal disorders are one of the most common causes of workplace injuries and lost working days across the world. These disorders affect different parts of the body including muscles, bones, joints, tendons, ligaments and nerves. Unlike major accidents, musculoskeletal injuries usually do not happen suddenly. They often develop slowly over time. At the beginning, a worker may only feel slight discomfort or mild pain. But if the problem is ignored, it can develop into a serious long-term health conditions that affects the worker's ability to perform daily tasks. In this element, we will cover the following topics: what musculoskeletal disorders are, common types of musculoskeletal injuries, causes and risk factors, manual handling, risk assessment using the 5-step approach, ergonomic principles, control measures, safe lifting techniques, early warning signs of injury, real life examples and exam practice. By the end of this sessions, you will clearly understand how musculoskeletal injuries occur and how they can be prevented in the workplace. Let's begin. First, we talk about what are musculoskeletal disorders. Musculoskeletal disorders, often referred to as MSDs, are injuries or disorders that affect the body's movement system. This system includes muscles, bones, joints, tendons, ligaments, nerves. Musculoskeletal disorder can develop in two ways. They may occur suddenly because of a single event such as lifting a heavy object incorrectly, or they may develop gradually due to repeated movements, awkward postures or continuous strain over a long period. These injuries are often painful and may reduce a worker's ability to perform normal job tasks. Now let's talk about common types of musculoskeletal disorders. Some common examples of musculoskeletal disorders include back injury, slip disc, shoulder strain, neck pain, tendonitis, carpal tunnel syndrome, sprains and strains. Among these, back injuries are the most common. They frequently occur in jobs that involve lifting, pushing, pulling or carrying heavy loads. Because of this, manual handling activities are a major focus in workplace safety management. Now let's talk about the causes and risk factors. Musculoskeletal disorder rarely occur due to a single cause. In most cases, they develop because of a combinations of different risk factors. Let us look at some of the main causes. The first one is manual handling. Manual handling refers to any activity where a worker uses physical effort to move or support a load. This includes lifting, lowering, pushing, pulling, carrying, moving object by hand. Improper lifting techniques and heavy loads significantly increase the risk of musculoskeletal injuries. For example, repeatedly lifting heavy boxes from the floor without proper technique can easily cause back strain. Now, second is repetitive movements. Repetitive movements occur when the same motion is performed repeatedly over a long period. Examples include typing, packing products, or performing assembly line tasks. Continuous repetitions can strain muscles and tendons. Over time, this may lead to repetitive strain injuries. Now, the third one is awkward postures. Working in awkward positions places extra stress on muscles and joints. Examples include bending for long periods, twisting the body while lifting, reaching above shoulder height. These types of postures increases the likelihood of injury. Now the next is forceful movement. Some tasks require workers to apply significant physical force. For example, pushing heavy equipment or gripping tools tightly. Excessive force increases pressures on muscles and joints which can lead to injury. Now the next is vibration. Using vibrating tools and machinery for long periods may also increase the risk of musculoskeletal damage. This common seen in workers using power tools such as drills or grinders. And the next is poor workplace design. Poor workstation design can also contribute to musculoskeletal disorders. Examples include incorrect chair height, poor monitor positioning, insufficient workspace, improper tool design. When the workplace is not designed according to ergonomic principles, workers are most likely to experience long-term strain and discomfort. Now let us discuss how we actually carry out a manual handling risk assessment. Manual handling risk assessment follows the standard 5-step risk assessment process used in health and safety management. The purpose is simple: to identify hazards, evaluate risks and implement control measures before injuries occur. Manual handling injuries, especially back injuries, are among the most common workplace health problems. Because of this, every hazardous manual handling task should be properly assessed. Let us now go through the 5 steps clearly. The first step is to identify manual handling tasks that could cause injury. In this step, we observe the work activity carefully and identify tasks that involve manual movement of loads. Examples include lifting heavy loads, carrying materials over long distance, pushing or pulling heavy equipment, repetitive lifting tasks, handling awkward or unstable loads. During this step, we look at how the task is performed. For example, if a worker is repeatedly lifting heavy boxes from floor level, this creates a significant hazard because it involves bending and repetitive movement. The goal in this step is to clearly identify where the risks exist. In the second step, we identify who may be affected by the hazards and how they might be injured. Workers who may be affected include warehouse workers handling goods, construction workers lifting materials, healthcare workers lifting patients, office workers moving equipment or furniture. It is also important to consider vulnerable individuals such as young workers, pregnant workers, workers with existing back or musculoskeletal problems. Next, we consider how these workers might be harmed. Possible injuries may include back strain, muscle injury, slip discs, shoulder or neck injuries. Now we come to the step number 3, which is evaluate the risks. In this step, we assess how serious the risk is. Several factors must be considered when evaluating manual handling risks. This includes how often the task is performed, how heavy the load is, whether the worker's posture is awkward, whether twisting or bending is involved, the conditions of the working environment. For example, if workers are lifting heavy loads frequently without any mechanical assistance, the risk level will be high. However, if lifting equipment such as trolleys or hoists is available and used properly, the risk may be lower. The purpose of this step is to determine whether existing control measures are sufficient or whether additional controls are required. Now the step number 4 is implement control measures. If the risk is not acceptable, control measures must be introduced. Control measures should follow the hierarchy of controls. The first option is always eliminations. If possible, eliminate manual handling entirely. For example, automate the process using machinery. If elimination is not possible, the next step is to reduce the risk. This can be done by using mechanical aids such as trolleys, hoists or conveyors, reducing the weight of the load, improving workplace layout to reduce carrying distance, providing proper manual handling training, rotating tasks to reduce repetitive strain. It is important to remember that engineering controls are always more effective than relying only on training. If the task itself is unsafe, training alone will not prevent injuries. Now the step number 5 is record and review. The final step is to record the findings of the risk assessments. Proper documentation should include the hazards identified, who may be harmed, the control measures implemented, the date of the assessment, the name of the persons conducting the assessment. The risk assessment must also be reviewed regularly. A review should be carried out after an injury occurs, when the task changes, when new equipment is introduced or during periodic safety reviews. Manual handling risk assessment is not a one-time activity. It must be regularly reviewed to ensure that control measures remain effective and that musculoskeletal injuries are prevented. Now let us discuss the control measures used to reduce musculoskeletal risks. When controlling musculoskeletal hazards, we should always follow the hierarchy of controls. This is a very important concept in health and safety and is often asked in exam. Let us understand each level of control. The first one is eliminations. The most effective control is eliminations. This means completely removing the need for manual handling. If a task that requires workers to lift heavy loads can be replaced with an automated system, the risk can be removed entirely. For example, installing a conveyor belt system instead of workers carrying materials manually. Whenever elimination is possible, it should always be the first choice. Now the second is substitutions. If elimination is not possible, the next option is substitutions. This means replacing the hazardous activity with a safer alternative. For example, replacing heavy materials with lighter materials or dividing a large heavy load into smaller and lighter loads. This reduces the physical strain on workers. Now the third one is engineering controls. Engineering controls involves physical changes to the workplace or equipment to reduce their risks. Examples include using mechanical aids such as trolleys, hoists or conveyors, providing adjustable workstations, using properly designed tools and equipment. Engineering controls are more effective than relying only on training because they remove or reduce the hazard at the source. If workers still need to lift heavy loads manually, training alone will not fully protect them. Now the next is administrative control. Administrative control focus on changing the way work is organized. Examples include job rotations to reduce repetitive stress, limiting exposure time to physically demanding tasks, implementing safe working procedures, providing manual handling training. These controls help reduce risks but are generally less effective than engineering controls. And the final is personal protective equipment. Personal protective equipment or PPE is considered the last line of defense. Examples include gloves with good grip, supportive safety footwear. However, PPE should never be the main control measures. It should only be used as additional protections when other controls are already in place. Now let's talk about the next topic, which is safe lifting technique. Even when control measures are implemented, workers must still be trained in proper lifting techniques. Correct lifting techniques can significantly reduce the risk of back injuries. The basic steps for safe lifting include: assess the load before lifting, stand close to load, keep your feet apart for stability, bend your knees, not your back, keep your back straight, hold the load close to your body, avoid twisting while lifting, move your feet instead of twisting your torso. Using proper lifting techniques reduce the strain placed on the spine and muscles. In the exam, it is important to present these steps in a structured and clear way. Now let us talk about ergonomics. Ergonomic means designing work so that it fits the worker rather than forcing the worker to adapt to poorly designed tasks. Good ergonomic design includes adjustable chair and desks, proper monitor height, neutral wrist positions while typing, adequate leg space, reducing excessive reaching or stretching. The goal of ergonomics is to reduce physical strain and improve comfort and efficiency. Proper ergonomic design plays a key role in preventing musculoskeletal disorders. Now let's talk about the early signs of musculoskeletal problems. It is very important to recognize the early warning signs of musculoskeletal disorders. Common early symptoms include pain or discomfort, tingling or numbness, reduced range of movement, swelling, weaknesses. Workers should be encouraged to report these symptoms as early as possible. Early reporting allows early interventions, which can prevent the problem from developing into a serious long-term injury. Now let us look at a practical example with a real-life case study. In a warehouse, workers were manually lifting heavy boxes repeatedly throughout the day. No mechanical aids were provided. After several months, multiple workers began complaining of back pain. An investigation was conducted. The investigations revealed workers had not received manual handling training. No manual handling risk assessment had been conducted. Lifting equipment was not available. Corrective actions were implemented. These included introducing trolleys and pallet trucks, providing manual handling training, rotating tasks to reduce repetitive strain, reducing the weight of loads. Within a few months, the injury rate decreased significantly. This example clearly demonstrates the importance of proper risk control. Now let us look at some important exam practice questions. Define musculoskeletal disorders. outline risk factors associated with manual handling, explain the 5 steps of manual handling risk assessment, describe control measures for musculoskeletal risks, outline safe lifting techniques. Now, this is the conclusion part. Element 6 focuses on preventing musculoskeletal disorders in the workplace. These injuries are very common, but they are also preventable. They often develop gradually and may lead to long-term disability if they are ignored. Through proper risk assessment, ergonomic design, engineering controls, and safe lifting techniques, musculoskeletal risks can be significantly reduced. Protecting musculoskeletal health improves productivity, reduces absenteeism, and protects the overall well-being of workers. I hope through this video you have clearly understand element 6. If you have any doubt regarding this, you can comment below.